Hey everyone, how's it going? My name is Patrick Liu. I'm a second year student physical therapist at the University of Maryland Eastern Shore, and welcome to the Diabetes Management Group. Before you watch this video, please like this video, subscribe if you haven't already, hit the notification bell for updates about our upcoming content, share this video with anyone you think would benefit from the contents of this video, and comment down below of your thoughts, feedback, and everything more with it. Now, let's get started. So the topic for today's video is when should you get tested for type 2 diabetes? And in my experience, I've kind of noticed that I had multiple symptoms that were correlated with the hallmark signs of type 2 diabetes and partially type 1 diabetes. And that would be frequent urination, so having the urge to go to the bathroom very frequently, to pee. The other one is feeling excessively thirsty despite drinking copious amounts of water or liquids. Feeling extremely fatigued and tired no matter what you do. So even if you get the 8 hours of sleep and even throughout the day, whenever you exercise or do anything in general, you just kind of feel really tired and exhausted without any explanation for why you feel exhausted and feel that way. The other one too is feeling extremely hungry. So despite eating some copious amounts, you feel satiated for a little bit, but then probably 10, 15 minutes afterwards, you still feel that extreme hunger. Sometimes it could even be hunger pains. For me, generally, I felt like someone was punching my stomach and ripping my stomach out, and that's kind of how bad my hunger pains have gotten. And the other one is just unusual or unexplained weight loss. Now, personally, for me, I didn't really see too many changes in my weight, whether that was weight gain or weight loss. But if you have a combination of some of these symptoms, I would recommend trying to take the diabetes risk assessment, which we'll go over in a little bit. Now, those are more of the hallmark symptoms that can be early indicators for it. The other ones could be some major indicators. So if you have frequent infections with any open wounds that you've had or just infections in general, that could be one of the symptoms associated with it. If you have blurred vision or sudden vision changes, that could be another huge symptoms with that. That's called diabetic retinopathy, and it is a serious condition, and you definitely need to get that checked out. Tingling or numbness of the hands and feet. It's more common for people with type 2 diabetes to have the tingling and numbness in their feet and toes. And it's generally recommended to check your feet and toes if you have those altered sensations, because you will be stepping on a lot of materials or contacts, and that could increase the amount of friction there. So you could actually develop calluses on like the top of your foot, around your foot, or may develop some pressure sores in between your toes or all along with those different areas. Now, this is not meant to try and scare anybody or those sorts of things. I'm just saying that if you notice some of these symptoms that I'm talking about, it may be in your best interest to seek out your primary care provider to see if you could have a test done to determine what your blood glucose levels are or your blood sugar levels are, to see if you are at risk for diabetes or if you have diabetes, depending on the indications. And then other major symptoms to be aware of is when you have cuts, bruises, or sores that take significantly longer to heal and like recover from. So let's say, for example, if someone has like a small minor bruise, maybe about this size over here, like a quarter size, and it doesn't heal within like a week or 2 weeks. Instead, you notice that it takes months to heal, or it may even get worse. That could be another symptom with it. And then any reoccurring skin, gum, or bladder infections. So if you have like a urinary tract infection, aka UTI, that's pretty frequent, or you have gingivitis, that could be indicators for it if you have those frequent recurrences of the infections. So now we'll get into what the diabetes risk test looks like. Okay, everyone, so here is how you can access the Diabetes Association's risk assessment tool. You can type into the search bar diabetes risk assessment, and you press go. You could do this on your laptop. I'm just showing it on what a mobile phone looks like. You could press risk task with the American Diabetes Association. It'll take a second to load. It takes about a minute. And then you could either take it for yourself or someone else and select the language appropriate for it. So for us, it'll be English. We'll do it for myself. And then it'll ask how old you are, what your gender is. And whenever it talks about gender, it's primarily talking about your assigned sex instead of like your gender identity. And then any familial members that have diabetes. So, you just press that. And then high blood pressure if you have that. And then I'll ask if you're physically active. Race and ethnicity that best describes you. And if you always question, why are they asking that? You can always press that item right over there. And then height and weight. So I'm about this tall and this weight. And then right here, you could put your email and zip code to then see your results on there. And it'll tell you what your risk looks like for that. Email here. And then a zip code. And email your results, and then afterwards you can kind of see what your risk looks like. But keep in mind, even though I'm someone with low risk, I was still diagnosed with prediabetes. So if you feel like it's still a concern and you have those variety of symptoms and everything, don't be afraid to speak up during your primary care provider's visit to ask for those assessments and everything. You are your own advocate, and I'm just kind of sharing some resources that are out there that may or may not be beneficial. All right, everyone. Thank you so much for tuning into this video. Hopefully you found this helpful. And again, please like, comment, subscribe, hit that notification bell for updates of our upcoming videos. Share this with anyone that you think it would be helpful for. And if you do have any questions and stuff, feel free to leave a comment down below. I have my contact information provided below as well. And I put some disclaimers in the description of this video, so please make sure you check that out. Thank you so much for everything, and I'll see y'all in the next video. Have a good one.